Hello, I'm Steve Allen. I'm a NAIOMT faculty member and here to talk to you about a strategy for an injured runner. One of the more common lesions I see clinically is the high hamstring tendinopathy with suspect traction type injury of the tendinous insertion of the hamstring on the ischial bone. As we know, there's a lot of fascia associated with that attachment that continues cephalad up into the deep fascia of the lumbar spine, and in fact will cross over contralaterally into the opposite side of the lumbar spine. What I want to do is take a strategy that regains strength. So what I'm going to demonstrate here is a lift and bend strategy to try and enhance strength in the gluteus hamstring complex, especially tied in with the low back. What Gracovetski has showed us is that if you can lift and bend by losing lordosis, you have advantage of the interspinous ligaments. They become taut, and you now have a mechanism for the fascia that the gluteus maximus attaches to enhance that strength. So let's take a look at a lift and bend strategy on a potential injured runner. Before I have Sean demonstrate this lifting procedure, we'll just think about, and this is how I would talk to my patient. There's several ways we could have him lift and bend. We could use a knee strategy where he keeps his back fairly straight and goes down with bent knees. Sean, could you just demonstrate that lift? So if it was a lift strategy using knees, the problem with that is you may be protecting something in the back, but you have no power coming up with any weight. Let's come back up. On the other end of that, if it was a back strategy, he would bend more from his back and lean over to get the weight. And I think all of us would agree clinically that looks problematic. So it would come. The mix, and I'm basing this approach on Gracovetski's work on looking at the interspinous ligaments and the merging into the thoracolumbar fascia and the merging in of the gluteus maximus to that fascia. The best way I can take advantage of that clinically is use the hips. So on a high hamstring tendinopathy, let's say left side, we're going to use a hip strategy to regain strength on this complex. So Sean, I'm going to have you now go ahead and use the hip strategy as we've talked about. Drive your hips back, and key to watch is losing his lordosis. Because when his lordosis goes away, the interspinous ligaments become tight. Go ahead and lift. And his hips come back under. Let's do that again. The hips go back as though he's going back to sit in a chair. No lordosis. Now bring the hips under as you come up. Like so. And you can go ahead and let those down now, Sean. That's excellent. What I don't want to do is coach him on how fast to do that. Intuitively, his brain knows how much weight he's lifting, how fast he wants to move. The key thing we want to watch for is loss of his lordosis, which is important, that allows the gluteus to come into that fascial quadrant and stabilize lower lumbar spine and simultaneously strengthen this weakened segment that has been injured with running.